Hi, I'm Cindy Crook, and I'm glad to welcome you to DRH Live. Our guest today is Dr. Shay Miller, a general and vascular surgeon at Duncan Regional Hospital, and he is going to talk about vascular health and some of the screenings that we offer at our imaging center. Welcome.
Thank you. Well, I have to say this is my first time on CNN, so it's exciting to be here today, and I want to thank you guys. Sorry, they're telling me this is not NBC, excuse me. So thank you for joining us in NBC. No, I'm getting more feedback there. Thank you for joining us on Facebook. It's fun to be here today, and I look forward to telling you guys about vascular surgery. I'm a vascular surgeon. I practice at Duncan Regional Hospital. It's a privileged to practice here because we are on the leading edge of cardiovascular health. And our discussion today is going to center around cardiovascular disease and how we get cardiovascular disease, how we identify cardiovascular disease, and how we treat that. To start off, I want to divide the two categories. Some have heard of cardiovascular disease. Others have heard of vascular disease. What's the difference? Well, cardiovascular disease, as the name implies, is disease primarily of the heart. We learn that plaque forms within the arteries of the heart. It begins to create blockage. And that's ultimately how we have heart attacks, heart failure, and those sorts of problems. The same disease that occurs in the heart also can affect the rest of the body. And we see those same plaque deposits in very important arteries in the body, such as the carotid arteries that supply the blood to the brain. We can see that in the aorta, which is the main blood vessel to the lower half of the body. And we can see that in the arteries to the legs. And that oftentimes presents with pain in the legs, particularly when walking long distances. Some people will feel that pain after walking distances of a half a mile, while others have pain just simply trying to get up and cross the room. Many times that pain is an indication of the level of their disease. Unlike the legs, the carotid arteries in the neck don't often manifest with any symptoms at all until we see some of the more devastating manifestations, and that is when people present with a stroke. That is one of the diseases we like to identify and catch early before those severe symptoms such as stroke present, and we can sometimes head that off and prevent that from happening. So today we're going to talk a little bit about how we identify the disease and how it presents. We talked a little bit about the symptoms, and the doctors that are responsible for identifying cardiovascular disease start by looking at simple tests that we often call non-invasive tests. Non-invasive tests, to all you out there, means you don't get poked with a needle, and nobody has to do any cutting or anything that causes pain. This is some of the best tests in my mind because it's oftentimes just simply an ultrasound probe. Just like they look for babies and pregnant ladies, we examine the arteries in a very similar fashion. I haven't yet ever found a baby when I was looking for an artery, but there may be a day sometime. At this time, we look at the arteries of the neck using a carotid Doppler. And that ultrasound shows us inside the artery whether there is blockage, whether the flow is smooth, or if the flow is disrupted. Occasionally, we could find that the blood is completely blocked off, and that's scary stuff. We do the same for the legs, and we measure the blood pressures in the lower parts of the legs, and we study how the flow goes through the legs, and that gives us an idea if there's blockage. If those tests are negative, you can pretty much be confident that you're okay. If those tests show that something may be wrong, don't sell the farm. Those tests can sometimes have false positives, and actually still everything's okay, but it does mean that you need to go for the next level of tests. Those tests, the next level, sometimes involves having to have an IV. There's no worse than that. We call that test a CAT scan, and that gives us a picture, a representative picture of how the arteries look to our eyes, and we can see the blockage. This is a very important test for me and my team because my team will look at those tests and help us plan on how we're going to fix it. While we're on the topics of teams, it's important to know that vascular disease is best cared for in a team approach. And I'm exceptionally excited to tell you that Duncan Regional has an outstanding team approach. We started doing complex vascular surgery here in 2009 with repairing abdominal aortic aneurysms using simply wires and stent grafts. These are complicated cases that we put together a tremendous team that can go in and repair those in a way that many patients who have severe aneurysms and otherwise might not survive are walking out of the hospital in less than 24 hours from their surgery, pain-free. It's the closest thing that I've seen in my experience to a miracle in science, and it's really fun to watch that work. Our team has a number of great team members. Teddy Morrison is a nurse practitioner that works with us heavily, and she orders probably more screening tests than anybody in Stevens County, and she's a great resource for sniffing out some of these complex vascular problems. And she works in our office here on the Duncan Regional Hospital campus. After we identified the disease and we figure out what caused it and have started to make some of our mapping plans on how to fix it, most vascular disease today is fixed with stents and wires. At least every time we get the chance, we try to fix it with stents and wires. The reason is the fix is a solid fix that lasts a long time, but more importantly, it's very minimal pain, and patients can return to their normal activities as quick as possible. Occasionally, we have to do surgery, and we have some excellent surgical options for times when stents and wires won't work, and those patients also do very well and have very good long-term results. But the best long-term results are achieved when we modify the risk factors that caused us to have the vascular intervention to start with. The common causes for vascular disease are diabetes, high blood pressure, a lipid-filled diet, such as a high-fat diet, and probably the worst is smoking. So some of those risk factors are modifiable. We can change our diet. We can stop smoking. We can get better control of our diabetes, both with medication and diet. But it's critically important that we engage in a comprehensive lifestyle reform, because if we don't, the vascular disease is going to continue. It's going to get worse. And it's going to show up in different places. If you had disease in your right leg and we fix it and we don't change things, it's just a matter of time till we have it in the left leg and in the carotid arteries to the brain, or ultimately the arteries to the heart, which can result in a heart attack. Some really famous people in life have had big vascular disease and have come back and beat it and survived and gone on to long, productive, healthy lifestyles. And we've watched those people over time, watch their success, and that's fun to champion. I get to practice the best job in the world. I get to help make people feel better again. And vascular disease is important because those folks oftentimes have a lot of discomfort, and within minutes, we can make them feel better again. And that's what we all do the big high five about. So thanks for having me. Thanks, Cindy, for allowing me to participate in this CNN broadcast, NBC, CBS Fox, no? Weather Channel, excuse me. I didn't realize we're on the Weather Channel. So, thank you.
Well, we have a few questions.
Fire away.
Okay. Says that Pat says, my mother died of a heart attack at a very young age, and I am now the age she was when she passed away. Should I be getting some scans?
Well, that's a great question, Pat. So the first question I would ask you is, did your mom have any of those risk factors? And specifically, did she smoke? Did she have diabetes? And And did she have high blood pressure? And if she did, then you have to ask yourself, do you have those same risk factors? If you do, absolutely is the answer to your question about being scanned. Now, we know that some vascular disease is hereditary. We're learning that actually less is hereditary than we used to think it was. In fact, much of it is we take on the lifestyle of our parents. We tend to eat the food that our parents ate. We certainly know that there's a relationship that if your parents smoke, there's a higher chance that you're going to smoke. That should be very important to our young listeners out there, because if you smoke, then there's a higher than average chance that your children will smoke. We wouldn't want to pass that habit on to anyone else. So I think look at your risk factors, but certainly, and depending on your age, you may need some screening. I'll tell you some of your screening options. Duncan Regional Hospital has a great screening plan at our state-of-the-art imaging center. Our imaging center offers scans of the aorta, which is the main artery that goes down from the heart all the way down to the abdomen. And that scan takes about 10 minutes to perform. You get the results in 30 minutes. And they'll do that for $100 cash and don't even have to process that on your deductible or your insurance. They also offer a heart scan, which studies the arteries of your heart. It's a CAT scan. It's a rapid filling test. This is really new state-of-the-art technology that truthfully is only available in a handful of places across the state. But our technology here is equivalent to every CT scanner in Oklahoma City. And they do that for $99. If you come on the month of your birthday, you can get it done for $75.
Great. Walter says, I don't like taking medications. Is there anything I can do on my own to help myself if I have some like high blood pressure or anything like that?
Oh, Walter, you're not alone. I think most of us like the apple a day keeps the doctor away philosophy, and I'm with you. In fact, in 2018, I don't know that I would have more problems taking the medicine or having to pay for them because they keep going up in price. So I think the answer to your question is yes, but I'm very hesitant to offer that because I don't want this to be perceived to any of our listeners that Dr. Miller told me on CNN, the weather, Facebook, that I can stop taking my medicines, because that's not what I'm saying. But a healthy lifestyle is critical to overcoming vascular disease. And the key factor is exercise. Now, exercise will help your blood pressure, it will help diabetes, and it'll help circulation. So an exercise program is critical. Eating healthy would come in second and very important. And then third would be reduction in lifestyle stress limiters. So reducing our stress. So I guess what I'm saying is, Walter, maybe you should entertain becoming a vegetarian and moving to Fiji and just sitting on the beach and relaxing all day. But take your medicine with you, because I didn't say not to stop taking.
Very good. Anita wants to know, does a heart attack always feel like a sharp chest pain?
Well, Anita, I just take from your name that you're a lady, and ladies oftentimes present with different types of symptoms. So the official answer to your question is heart attacks can present in a lot of different ways. The common one that we hear is the crushing substernal chest pain with shortness of breath. And those folks typically will say that they feel like there's an elephant standing on their chest, or there's a band wrapped around their chest and it's just getting tighter and tighter. And sometimes they'll say that there's a pain that goes up their neck and it goes down their arm, and sometimes it can radiate through to the back. These are the common presentations of cardiac chest pain. But Anita, a couple of things that we have to worry about. First is a group called atypical presentation symptoms. And so that is found in about 10% of our patients, and they have very atypical presentation of chest pain. They can present with no symptoms at all. We may notice a drop in their blood pressure or an increase in their heart rate. And then there's another group of folks, particularly females, who present with a variety of symptoms that can range anywhere from the abdomen all the way to the chin. Some of those folks will present with jaw or tooth pain. Some will present with abdominal pain and discomfort. Night sweats, chills, palpitations are common symptoms. So be aware of all of those things, and if you're feeling those or if you're concerned, make sure you get checked out by your doctor.
Are there any physical symptoms of a blocked carotid artery?
Sometimes. That's a really hard question because a truly blocked carotid artery oftentimes presents as a stroke. So that's a sequence of symptoms that is very severe, and you'll know it if you've got it. It generally presents with slurred speech, drooping of one side of the face, weakness or numbness in one arm or one hand. And those folks need to get to the emergency department immediately. In fact, we have some incredible data that shows that their chance of surviving that stroke and getting rid of those symptoms is directly proportional to how long it takes them to get to the hospital. So it's very important that you go immediately to the emergency room if you have those symptoms. However, I think one of the questions you might be asking is, before it's blocked, when it's just really narrow, can it cause some symptoms then? And it can. And those symptoms can be transient or short-lived slurring of speech, some loss of balance, a little bit of weakness or numbness or tingling in fingers or toes, specifically if they're on one side. One of the ones we see is blindness in one eye. We call it lampshade blindness, and things go dark like a lampshade, and then they come back up. So those are things to watch for. If you're anxious about it, you have any reason to doubt, just come get checked out. It's easy. It's a quick ultrasound. I mentioned the aorta earlier. They also do that same ultrasound. It's a carotid ultrasound at our imaging center. Again, it's $100. It's quick. It's easy. It takes 10 minutes. And you get to go to bed with the relief knowing everything's okay, which, just like we talked about Walter, who's now in Fiji, laying on the beach, you can reduce your stress in your life as well by knowing that your carotids are okay.
Two more. This Bruce said, I have some arteries that have extremely high calcium scores on a CT and others that are 0. He said, does that tell you anything? He goes, I've never had symptoms and I bike and exercise every day, but I still have those high scores.
So Bruce, great question. High calcium scores do not necessarily delegate that you have cardiac blockage. But instead they are they're a risk factor or an early identifiable test that can find at-risk people. If you've been thoroughly evaluated by your cardiologist, particularly if you've had an angiogram and your arteries are open, don't be stressed out about your calcium. If you haven't been checked out and you got a high calcium score, Bruce, probably ought to go get it checked out.
Okay. And then Larry just wants to know, what is a blood clot and how can you treat them?
Great question, Larry. So for blood clots, I want to change the discussion a little bit because so far today, all to this point, we've been talking about the arteries of the body. Well, as we know, the arteries carry the blood from the heart out to our extremities. The veins are what carry the blood from our fingers and toes back to the heart. When we hear about blood clots, we typically are referring to the veins. And when I hear it most commonly, those are blood clots in the legs. And they're very scary because although they start in the legs, they can get in the bloodstream and circulate until they land in the lungs. And they can instantly block off all of the blood flow to and from the lungs, which, as you know, you can't survive without blood flow in your lungs. So blood clots are scary. We often hear them called DVTs, or deep vein thromboses. They often are treated with blood thinners. Sometimes we put in filters to catch them. But it's a really different topic than the artery disease we've been talking about today. Different set of risk factors, different set of tests that we need to identifiable. But equally scary, equally important that it get addressed.
Great. That's it. So I just want to thank you, Dr. Miller, for sharing this valuable information. We want to tell you that if you have any questions or concerns, we always recommend that you call your primary care taker, your physician. That the phone number you're seeing now is our imaging center if you're interested in either the heart scan or the aorta carotid artery scan. The imaging center could help you. And we just ask you to be on the lookout for our next DRH Live. Thank you.